The COVID-19 pandemic could have been less severe if all countries had, as a baseline, access to quality health services for its entire population. Countries that had a single-payer universal healthcare system had less disparities in COVID-19 fatality rates than countries that did not have UHC. Domestic and international disparities in outcomes really stemmed from healthcare inequities. Influential countries and partners must uphold universal healthcare coverage through end-to-end investments in health systems, including a more skilled and well-paid workforce, access to vaccines and medical diagnostics, and strong laboratory systems. All countries must increase their spending for public health. And resilient systems that are anchored in a strong health workforce must be the new aim for global health security. A healthy population will always be the first defense for future pandemics. We also learned through the COVID-19 pandemic that health security can no longer be about protecting rich countries from diseases originating from poor countries. It must be about connecting with and learning from communities, because all emergencies are local. And strong, connected communities that are plugged into what's going on in their healthcare system and who trust healthcare professionals. During the COVID-19, these communities were sometimes the difference between life and death. The world has a lot to focus on right now in terms of inequity. But if we keep doing things the same way, and I'll add using the same people, then we'll get the same results. The global governance architecture of multilateral organizations needs to change. They need to be more representative of the world that we live in. And so that means that we cannot stand for 7 out of 10 of the leaders of global public health organizations being men. There must be gender parity in global health leadership. Additionally, most of the world's population does not reside in Washington, D.C., New York, or Geneva. So it makes no sense for all high-level decision-making events to be in these cities. We must decentralize global health leadership. It must be inclusive. And not through a tick box exercise, but through the broadening of national government and civil society representatives in pandemic preparedness and response governance. International and intranational equity can only be assured through multi-stakeholder and multi-sectoral engagement at all stages of policy development. Any new or reformed international law must be anchored in humanitarian principles and ensure meaningful participation of marginalized groups in decision-making. This includes women, refugees, migrants, displaced or homeless populations, and racial minorities. A new pandemic accord will only be effective if there are clear national and subnational strategies and strong institutional and political commitment to universal health coverage.